People in Afghanistan, a global news hotspot where the danger of a humanitarian crisis loom large, are going through a turbulent phase. From jobs to food and medicine to shelter, more and more Afghans are losing their basic security covers with each passing day. Trade has declined substantially, hospitals are running short of staff, and not just COVID vaccination, the country has failed at inoculating other essential jabs too. Displacement coupled with unemployment has demoralized common Afghans with no light appearing at the end of the tunnel.
Hundreds of trucks can be seen stranded on roads leading to Afghan-Pakistan border as the trade between the two sides has been hit severely since Taliban swept to power in Kabul. Officials call it a ripple effect of the militant rule in Afghanistan and the economic consequences it brought along, including the frozen bank accounts of Afghanistan money by the US. Only a handful of them who are in business of fruits and vegetables have been profitable and moving around for it a season in the war-torn country. The others are dejected and hopeless. Pakistan government, which backs Taliban rule, has tried to spin a narrative of everything good at the border, but pictures signal an emerging crisis that can further push back Afghanistan's economy.
او امپورټ خو ډیر زیات را روان دی امپورټ خو تقریبا 300 350 پورې گاډي ډیلی بیس باندې راوځي امپورټ خو پاک کې مطلب ډیر مقدار د پیریشبل آیټمز دي چې کوم د انګور ټماټر پیاز بادرنګ دا شي را روان دي امپورټ کې.
An already weak health system of countries on the verge of collapse and shortage of doctors and nursing staff has cropped up, following several of them fleeing and women restricted by Taliban's Sharia orders. World Health Organization Director General Tedros Adhanom Ghebreyesus visited doctors, hospital staff and trauma patients at a Kabul hospital and said the country was facing an acute shortage of both medicines and vaccination doses amidst the instability. He said that cases of infant disease, polio, which was close to be eradicated in the country, could make a reappearance in the country.
Over the past 20 years, significant health gains have been made in Afghanistan in reducing maternal and child mortality, moving toward polio eradication, and more. Those gains are now at severe risk, with the country's health system on the brink of collapse. There has been a surge in cases of measles and diarrhea. Almost 50% of children are at risk of malnutrition. The resurgence of polio is a major risk, and 2.1 million doses of COVID-19 vaccine remain unused.
Tedros has also urged international community to come forward to help, but many of them have been reluctant owing to the crisis. Meanwhile, internally displaced Afghans staying in the capital Kabul said their hopes of getting back their jobs and homes were diminishing. Donors have so far pledged more than $1.1 billion to help Afghanistan, but that does not seem to have the caliber to evacuate country from deep crisis.
سالارا میخواهید خداوند آرامی و سایش آرامش بیاره دیگه کار غریبی بچه ها شود خانه نداریم بچه که یه چبلق فروشی میکرد چبلق در گرفت در قندوز سرای چبلق در گرفت اینا رو بیکار بیروزگار یه خانه داریم دیگه دربار خدا را داریم.
The UN High Commissioner for Refugees has said that more than 18 million Afghans, or about half the Afghan population, required humanitarian aid before the Taliban took over. More than 3.5 million Afghans were already displaced in a country that is battling drought and the COVID-19 pandemic. Poverty has spiraled across Afghanistan since the country fell to militants, and in words of UN Secretary General Antonio Guterres, Afghans are facing perhaps their most perilous hour.